Hello everyone. For this video, we're going to be testing or assessing the range of motion of the distal hamstrings via the active knee extension test. Some sport actions that involve activation of the distal hamstrings are of course going to be maximal speed sprinting. This is going to be mostly eccentric in the activation. And if we look at sports like basketball or tennis that involve lateral shuffling, as the hip opens up into abduction and is flexed, we know that the distal hamstring is going to be used in order to flex the knee. For the setup, it's going to be very similar to the active straight leg raise, where we're going to have the athlete or the patient lie supine on the floor. We're going to lock their leg in using the outside of our foot and our shin. This is going to limit external rotation of that femur. Then from here, you can see I'm using the inclinometer to ensure that the femur of the testing leg is going to be at 90 degrees or 90 degrees of hip flexion. Now, if we pause the video here, you can see that I noticed a mistake that I made prior in the active straight leg, and that is allowing the femur to rise off the floor by a posterior pelvic tilt. This is something that is going to be hard to manage as a lone practitioner. So this is where having another person on standby that can help ensure joint angles and whatnot is going to be very helpful in assessing range of motion. So you can see here, I'm adjusting my leg in order to do my best to ensure that that femur stays on the ground and posterior pelvic tilt is not achieved by the athlete. So a quick adjustment is made in order to keep that femur in its place and not allow for posterior pelvic tilt. However, this opens up the opportunity for external rotation of the femur, which you can see in her right foot here, which is going to invalidate these results as well. If we pause it again here, we can see yet another mistake that I made as a practitioner is not keeping that left femur at 90 degrees or that left hip at 90 degrees of flexion. This is going to, again, invalidate the results. However, still can get some good information out of it in terms of range of motion. However, from here, we're going to have the athlete extend the knee to their fullest range of motion here, and then we're going to line up the inclinometer on the tibia of the testing leg, and that's how we get the range of motion of the distal hamstring. We're going to skip ahead here to the other leg, and you can see again that in my attempt to limit posterior pelvic tilt, I again allow for external rotation of that femur, which is going to add degrees of freedom or skew the results of this assessment once again. You can see there, I do a better job here of keeping the femur at 90 degrees or 90 degrees of hip flexion of that testing leg. And again, going to line up the inclinometer with the tibia in order to test for degrees of freedom of the distal hamstrings. And just like every other test, we're going to get two measurements per side or per leg. We're going to take the average of those two measurements and compare them to the literature.